scientists are working on COVID vaccine you can drink.
Finally.
Okay? You can drink. Okay.
Finally.
So let me read this to you. A new type of vaccine. This is a CNET story. A new type of vaccine called mucosal vaccines, which can be taken as a swish and swallow oral vaccine or nasal vaccine, is being developed and could be available within a couple years. The QYNDR, as if we need another acronym to remember, oral vaccine developed by the U.S. Specialty Formulations, has completed its phase 1 clinical trial and is waiting on funding to proceed to more advanced trials. The vaccine is designed to survive the digestive system and induce the appropriate response. The clinical trial results from New Zealand are promising and offer hope that the vaccine will be available, a viable option for protection against the current COVID-19 variants. However, in order to get the vaccine to be advanced to additional clinical trials, funding from investors is needed. Okay, so if you guys wanting to invest, this is the story from CNET. You can go look into it. When you hear something like this, what do you think about? You know, for me, if this is a business model, you know, like CBD, okay, or THC, or you say, so now what are we doing? Let's talk about it from strictly the business model standpoint on what Pfizer's doing, what these guys are doing. I don't smoke weed. I probably should, but I don't smoke weed. Okay,
it'd be fun to watch.
I don't drink coffee. Thank God I don't.
Yeah.
Okay, you don't want me to drink coffee. I shouldn't drink Red Bull, Monster. What else is there? Any of that stuff? Don't get it close to me. Okay. One time we tested my urine, and they said this is the closest thing to Red Bull. Is what they said. That's a joke. It's not.
You don't need more.
But taurine. So I don't need any of it, right? But you know, weed is a different story. Okay. Yeah. So, anyways, so this guy's like, well, you know, we're selling weed oil now. Cool. Hey, this guy says, you're having lower back pains? Try the CBD oil to put on your lower back. Like, so does that mean my back is getting high?
Yes.
What does it mean?
Your
right?
spine.
Hey, if you're try these gummy bears, okay, or try these cookies, or try this, right? Anyways, what's the point? If it's legal and you're finding creative ways for people to be able to buy that, guess what? Credit goes to who? To the team,
the seller
that is getting creative.
Yeah.
So if vaccine is one method, is what? Shot. And they wanting to go on this side from the standpoint of innovation on how to get it into the system, fine. Yeah. You can tell them, good for the team that thought about this. Now, the other thing you have to pose and ask the question is level of trust, how comfortable people are about it. Is it something where the timing is good right now to announce it? Is it becoming to the point where everybody is in the camp of, yes, I'll take it? I don't know. What are your thoughts? What are your thoughts when you hear this?
I think the fact, and from what we saw, that they scared.
Andres, I don't think I've ever said this. Please raise Vinny's audio by about 5%.
Are you serious? That's the first
time
Did you guys hear that?
Because he lowered it by 10% when you were yelling about your drug deal.
But Pat, think about it. And as a business standpoint, what they did with Fauci and everybody in the government, they scared the shit out of everybody.
Yeah.
So we all know these type of people that are like, another booster. Give it to me, give it to me, give it to me. I give them props because now they have their loyal, brainwashed customers. Now just another delivery system, like you said. If they say there's a vaccine shampoo, I guarantee you people will just, the more, the better. And as we're finding out, Pat, the science hasn't been tested long enough to find out if it's going to affect you, which I think we're seeing that people are dropping left and right. They don't give a shit. Just give them more, give them more. I give them props as the seller, but as the people need to still wake the hell up.
Tom, what are you thinking?
Well, there's two things I see here. I see a startup business in biotech that's talking about clinical trials, advanced trials.
Yep.
In other words, not Operation Warp Speed, doing something over the course of time that medications and vaccines have been tested in history, not this BS acceleration that we had along with amnesty for the vaccine makers. I see that on one side. The other side, I see a glaring hole in this business model. If I was an investor, I'm sitting there, I would say, so you think there's going to be a long-term market for COVID vaccines? So you think COVID is here to stay and all the mutations are here to stay? You think there's a long-term market? And I would be sitting there thinking there saying, wow, you know, if there's really a long-term market for this, then unlike swine flu went, bird flu won, remember HV, whatever it was, bird flu, it kind of came and went because there was it ran the cycle. It ran the human cycle. And what have we heard about swine flu or bird flu out of Southeast Asia over the last 4 years?
Flu,
Gone.
Yep.
It's not gone, but we don't hear about it anymore because it is not affecting the mass of society. So I look at this and I say, so there's really going to be a long-term market on COVID. Are we the lab rats? Is somebody out there mutating this and so that they can sell product?
We're finding out that they are, though.
Last night we're sitting at this wonderful event with Adam, and so sitting across this guy who was a follower of the podcast, great guy, 37 years old, successful guy, solid guy, good-looking guy. And he says, Patrick, 99% of what you say, I sit there and I say, yup, I agree. Yeah, he's probably listening. Yup, I agree. Yup, I agree. But there's the one part where you're not for DMTs and not for psychedelics and all this stuff. I'm like, dude, we got to get Patrick on psychedelics. I remember, I've never been a drug guy, never smoked weed, never did this, never did that. 34 years old, I went through a bad breakup. First time I did, psychedelics, it was life-changing for me. I said, that's awesome, man. Very happy for you. So then the guy to my left is like, your personality, I know. You probably would never do psychedelics, but maybe you would. So I'm like, okay, here we go. So now I'm invited to a party where everybody wants to get me to do psychedelics. Okay,
great,
fantastic. Another a great party that everybody wants me to do something. So then this girl shows up. Hi.
Two eyes.
So look, we're trying to get Patrick to do psychedelics. So why don't you try psychedelics?
Yeah.
She says, do you follow science? I said, define that.
Fauci.
By the way, no. She literally says, do you follow science?
Yeah.
I said, can you define that? Because it's been a little bit confusing lately.
Yeah.
She says, no, science. I said, well, if I have to trust the science, that means I have to take vaccine. And no, I don't trust that science. Mm-hmm. But what do you mean by science? She says, well, let me ask you a different question then. Do you trust the FDA? No. She says, what do you believe in?
What do you
I
believe
said, so what do you believe in? She says, no, I'm asking you the question. I said, no, I want to know what you believe in. Well, I believe in spirits collide, and I believe in, certain, what did she say? She said some stuff like this, like, and that energy, if I can have my energy, I can give it to you. I said, I agree with that. And I'm saying, so I agree with that. She says, so now I'm going to ask the question, what do you believe in? I said, I believe in God. I believe in good relationships. I believe in never compromising your values and principles that fully believe in, your convictions. Don't convince everybody to buy into your vision. Not everybody's going to understand your vision. And then she says, well, she says, so you would probably never do. She says, what if I bring you an expert that gives you all the data and all the articles, all of it, that proves that psychedelics are good for you? I said, I'd love to have him debate somebody who's a doctor and a scientist who has articles that scientist is not showing that opposes why psychedelics maybe aren't good for you. And I would listen to that debate, and I would make up my mind at the end. She said, you just sound close-minded.
Oh, God.
And then Adam asks a question and says, so tell me about you. Adam's trying to be his sweet self. So he says, so tell me about yourself. So are you married? Do you have kids? Or I don't know what you asked. Are you married? Yeah. She says, you would never ask a man that question. And then Adam says, I actually would.
Ask it all the time.
And Adam says, why are you so defensive? So she is now turning red.
Oh, God.
So I'm talking to my boy here. I'm having a really good time with this guy because we're talking about trying to figure people's personalities based on when they're born.
Psychedelic guy? Or
this guy's a chill guy.
Yeah.
He's a guy with Deepak's team for 26 years.
Chopra team.
Really enjoying him. He's half Persian, half Venezuelan, half all this stuff. Literally.
Sweet guy.
And sweet guy. Great conversation. And I'm getting up. I'm like, okay, Adam, I'm going to take off, man. I'm going to go home. She says, oh, I'm so sorry. Did I say? I said, no. Yeah, I said, listen, my life is too great for you to upset me. Thank you so much. It was great talking to you. I'm going to take off. And the entire time was like trying to now redeem herself from this high quality. Here's the point. She seemed like a sweetheart. She's just been fed because she's from, Maryland, venture capital. She traveled 6 months, all this other stuff, right? In that world, you trust science. Mm-hmm. In the world and the life I've lived, you trust debate. Mm-hmm. You trust people debating. Because if you've lived my life, that's what I trust. I trust two experts who are 100% convinced they're right. Let them hash it out. Well, one of the things I said last night, I don't know if you remember this, I said, you know what we've learned the last 2.5 years? She said, what? I said, experts using data have forced all of us to believe in what they're believing in. And they've divided the world. So I don't trust experts that use certain data they want to choose to validate their arguments. I kind of want to see both sides. I like debate. Okay, so if you enjoyed this clip, you want to see another one, click here to watch another clip. And if you want to take advantage of the latest Gold Signature Series products that just came out, We have a bunch of new merch that's out. This is a color-changing mug when you drink coffee. That lion turns into a real lion. And then we have hoodies with Valuetainment Gold on it, the Gold Signature Series hat, shirts. I'm an entrepreneur. Anyways, we have a lot of items. They're selling out. If you want to take advantage of the Gold Signature Series, click here, place your order, sport your Valuetainment gear, and tag us with the hashtag Valuetainment.